Good afternoon, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined by members of my cabinet who will join me in this briefing about COVID and about the district's preparedness for in-person learning starting in term 2 for D.C. public schools. I'm joined by Dr. Nesbitt, Chancellor Farabee, Chris Rodriguez, Chris Geldhart, and City Administrator Kevin Donahue. Let me start with a few comments about COVID and also show our daily metrics charts, which are color-coded, and all the explanations about these metrics can be found on coronavirus.dc.gov. Today, we reported 39 new cases in our community with no additional lives lost, gratefully. And we are also reporting a case rate of 7.4 cases per 100,000 people. Our goal, of course, is to turn all of those boxes green to advance toward additional activities being turned on in our city. I also want to turn to some news that we made available, an additional tool this week. If you haven't turned on this exposure notification, I'm going to ask you to go to your iPhone or your Android and do it now. The more people that opt in to DC Can, which is our COVID exposure alert notification, the better our health department can work with DC residents and workers to keep DC safe and to stop the spread of COVID-19. So please go to DC Can. We spent some considerable time talking about how it works, and you can learn more about how it works by going to coronavirus.dc.gov/DCCan. And before I turn things over to our public schools team with Chancellor Farabee and Deputy Mayor Kine, I want to just also say that we're making some more adjustments to our service delivery. And beginning Monday, November the 2nd, our community-based providers will take over all of our grocery distribution sites. So residents will still be able to get free groceries at grocery distribution sites across all 8 wards. And our shift to trusted community providers will ensure that our response and recovery continues long-term, and we can continue to meet the nutritional needs of DC residents. So on our website, you will find listed partners across the city who are helping to distribute groceries, and over the next 2 weeks, we will make sure residents know about all of these options. And once again, you can go to coronavirus.dc.gov to find out more. Now we are going to provide an update on our planning for term 2. Chancellor Farabee will speak more about this. And I just want to thank all of our team, our public schools team, who has been planning in working very hard on very complex issues. I want to thank our teachers and staff who have been nimble in switching on a dime to virtual learning and staying engaged with students and families throughout. I want to thank our families for staying close and looking for the information that the schools are going to be providing and contacting them with, and thanking them in advance for turning around their responses just as soon as possible. And I want to thank our kids for being resilient, for listening and following the instructions of their teachers and families, and for being hopeful about all of us getting on the other side of this pandemic. So with that, we will go to the Chancellor's update.
Thank you, Mayor Bowser. I am also extremely grateful for the work of our teachers and our staff who have worked tirelessly to transform our classrooms into virtual places for students to learn. The creativity and the way that our staff has engaged our students has truly been remarkable. We're also very grateful for our families in supporting our students at home. Despite our progress, we know yet still learning at home is not a working solution for every student, every family. And as a result, we must adapt to the needs of our students and our families and provide an opportunity for students to have in-person experiences for those who choose it and those who need it. We know that we have been away from our schools for almost 7 months or more, and we're starting to see the effects of that on our student achievement. As a result, we're on an urgent mission to ensure that we fulfill the response to the needs of our students and families, which we know will have an impact not only for this school year, but a lasting impact for years to come. On this slide, we provide an overview of how this is impacting our youngest learners as we have prioritized our students in our elementary grades for in-person experiences for term 2. We have assessed our K-2 students on their early literacy skills for beginning of year, and it's important to note that we have seen a 9 percentage point reduction in those students meeting or exceeding their literacy benchmarks. And again, this is a comparison of where we are beginning of year this year compared to last year. We've also seen a 22% point reduction in our kindergarten students meeting or exceeding these benchmarks. And then for our students that are receiving special education services or our English learners, we are seeing even wider gaps of those students than we've seen before. And so we need to ensure, again, that we fulfill our mission of responding to the needs of our students and our families. And for those students who need instruction and learning in school, provide it. This is important because we know that those students who are not reading on grade level are much more likely not to graduate on time, and it's critical that our students are reading on grade level by grade 3. For planning for term 2, DCPS continues to play great priority on the health and safety of our students and staff. In doing so, we are committed to ensuring that our environments are prepared to provide in-person learning experiences for our students. We're also taking health and safety precautions very seriously as outlined by DC Health, as well as safeguards that have been recommended by CDC and our union partners. We will continue in good faith discussions and bargaining with the Washingtonian Teachers Union as with our other partners to ensure that we are providing our students with access to high quality instruction. To do so, to provide the health and safety and well-being of our students and community, we will continue to prioritize facility readiness. We will ensure that we have the appropriate health and safety routines, and we will provide COVID testing and response protocols accordingly. We've already invested $31 million in safety measures thus far for our schools. We've also provided an additional $3.6 million in protective equipment and also $4.5 million in building readiness and $24 million in HVAC enhancements. Here you can see a design of a classroom that is designed around the social distancing expectations for our classrooms. It's also important to note that we are providing signage within the classroom and throughout the building to support social distancing. We'll also be providing plexiglass at the top of our dividers for students in the classroom, and cleaning supplies and procedures will be enhanced with standards related to CDC guidance, and also ensure that all of our supplies are on the EPA registered list. We will also have a health isolation room for our schools to ensure that a medical professional is available to provide any supports to a student or staff member, and the staff member or student that may have symptoms of COVID-19 will be isolated under the supervision of the health professional. For facility readiness, we have, again, a huge investment in our HVAC enhancement. This $24 million investment allows all of our classrooms to have a mobile unit that is described here, illustrated on the slide, that includes ultraviolet light and also the medical grade filterization and ventilation features. And so this includes the MERV 13, MERV 14 filters, which is the highest standard for filterization. We are purchasing and procuring over 3,000 of these mobile devices, which allows us to cover approximately 1,000 square feet. And it's important to note that the typical classroom ranges from about 700 to 800 square feet. As it relates to health and safety readiness and routines, DCPS has also procured the appropriate face coverings and also other supplies and materials to ensure our health and safety protocols are followed. Here you can see some examples of the items that schools have received. You can see examples of signage that schools receive, face covering, and we already have distributed to schools over 1.5 million disposable masks, over 320,000 child-sized masks, and over 80,000 commuter masks to help with special population, along with installing over 87,000 face shields within our school buildings. And so again, we are prepared to deliver on the health and safety protocols, and the supplies have been distributed to schools accordingly. We have the capacity to respond to any testing needs within our buildings, and we've established also response protocols. There will be on-site rapid testing for any symptomatic student or staff member, and we will have the ability to provide prioritized testing for any staff member that is supporting in-person experiences, whether that be our in-person learning classrooms or our student care classrooms. We will continue to provide great transparency and accountability as relates to our health and safety protocols. Each school has a site-specific operational plan that aligns with the health guidance that we are establishing for all of our schools. There'll also be written verification of all of our HVAC enhancement work, and so as that work is completed and is inspected, we'll provide any written documentation accordingly. We will also be providing each school with its own readiness checklist that must be completed and will be posted online. And once the school year has been launched for reopening, there will be ongoing compliance monitoring throughout the school year to ensure that we're in alignment with our health and safety protocols. This is an example of a DCPS readiness checklist. You can see this is an example for Aton Elementary School. Again, important to note that this is a sample, but it gives you a flavor of what to expect will be posted online. And it's also important to note attached to this is a link to the school's individual operations plan that provides detailed information on the health and safety protocols that are specific to that building. As relates to staff supports, DCPS is prepared to go beyond the federal protective leave and local accommodations for staff, for flexibility for individuals that are requesting time away or are requesting to maintain in a virtual status for their assignments due to their circumstances. DCPS is also providing all of our teachers the appropriate planning time and providing additional planning time beyond our collective bargaining agreement requirements. We're also allocating additional days for professional development for staff going into term 2 to ensure that they're appropriately trained on our health and safety protocols, they're trained on our trauma responsive practices, and we're also supporting students in their transition. Again, as I mentioned earlier, we are on an urgent mission to ensure that we are responsive to the needs of our students. And we know that if we are successful in fulfilling this mission, that there will be consequences, but the significant benefit will be that our students will have the academic supports they need to be successful, and we are addressing our known opportunity gaps for our students. And so we will continue to ensure that we are prioritizing our youngest learners, and ensuring that those students are reading on grade level by grades 3, and ensuring that we are accommodating the appropriate supports for our pre-K 3, pre-K 4 students. And also, this is an opportunity to address the well-being of our students. Many of our students have not been with their peers in months. We know that there are benefits to their social emotional development and being in school, and also establishing strong relationships between not only their peers, but their teachers as well. We are continue to have conversations with the Washington Teachers Union in good faith. We've had many conversations since July. We've dedicated over 100 hours to discussions with the Washington Teachers Union around our reopening plans, including health and safety. And we remain committed to this dialogue. We are actually at the table today for discussions. We had discussions earlier this week, last week, and we're still hopeful. We're still optimistic that we will reach a common ground. I know President Davis has also expressed her commitment and optimism for this as well. In terms of term 2, there are some next steps that we want to ensure that are really clear for our families and our community. We will continue to track towards providing our in-person learning classrooms, and we're in the process of providing offers to families that have been selected through the randomized selection process in alignment with the priority groups that we've identified, which includes our students that are experiencing homelessness, our students receiving special education services, our English language learners, and also our students identified at risk. We are making offers to those families on tomorrow, and beginning tomorrow, families will receive a call and an email, and we'll have 2 school days to respond to those offers. And then we will then offer our care classroom seats beginning next week to begin on October 30th. For those families that receive a call or email for an offer, again, it's important to note you have 2 days to respond, and we want families to respond as soon as possible. If we're not able to reach a family, we'll continue to reach out. But if we do not have contact with the family, the offer will expire in 5 days. A family must accept their seat again as soon as possible. And families are also reminded for students to have in-person experiences, whether that are in-person learning classrooms or our care classrooms. They must have a clear immunization record as well. Important dates for families and communities to know. Again, notifications will go out starting tomorrow for our in-person learning seats. Families, please respond as soon as possible. Notifications will start going out to families on October 30th for our care classroom seats, and in-person learning for grades pre-K through 5 will begin in term 2 on November 9th. Prior to November 9th, we will have professional development sessions for staff and teachers supporting our in-person learning experiences. On November 16th, the week, we will begin our care classrooms for students in pre-K 3 to 1st grade. And beginning the week of November 30th, our care classrooms will begin for those students in grades 2nd through 5th. Again, reminder to families, they must have a clear immunization record for their students to participate in the in-person learning classroom or our student care classrooms. Families are welcome to go to our website and encouraged to do so. That is dcpsreopenstrong.com. There they will have access to information around the in-person learning classrooms and our student care classrooms and seat offering, and we will provide the operational list and checklist information for each school as well. Thank you.
Thank you. Any questions? That concludes our briefing. Yes, Perry?
Yesterday on Hojo, you said that one of the holdups with the union is who gets to sign off on that a building is safe or has met the safety checklist. What's the hesitance in having someone other than from DCPS and DGS sign off on this as well? Meaning, why not say a teacher who's present for the walkthrough can be one of the people that sign off?
So it's important to note that, we've been really clear around our process of the inspection process, which includes significant expertise and ASHRAE expertise, which is the national standard on HVAC filterization and ventilation. We believe that expertise is sufficient. We don't believe it's appropriate to provide the authority to community members or those that may not have the expertise to evaluate the work that has been done. We believe that that is a government responsibility, it's a responsibility of DCPS in collaboration with our partners at DGS. And we've also identified the contractors to complete the work, and there's an inspection process that goes after the work is completed of the contractors. And we believe that is sufficient, and there's just not the expertise among community members or others that would have the ability to appropriately veto, if you will, or have the authority to determine that a school is not ready for opening.
So who's signing off? It's the contractors or contractors and people from DCPS?
So,
From what you...
yeah, so we have a national expert that is a part of the ASHRAE task force that has been tasked with assisting organizations like school systems with evaluating their HVAC systems to mitigate transmission of COVID-19. As a result, that national expert designed a specific course of action for every school that DCPS is delivering on. We have contractors that are delivering on those plans, and then as a follow-up, that national expert and their team checks the work of those contractors to ensure that that work has been done appropriately.
Yes.
Yesterday, the Washington Teachers Union president outlined a list of some of their demands from their memorandum of agreement. You've answered some of their demands when it comes to HVAC and the walkthroughs at the schools. Curious about their demand for PTO if a teacher is exposed at work, in classroom at work, and everyone getting a COVID test before reporting to duty, as well as free testing. Where are you all on those points? I know you said that they will be prioritized at testing sites, but are you able to do that from a financial, from a logistical standpoint, answer those demands as well?
Yes.
All of it. The PTO for...
What is PTO?
Pay time off for getting exposed while at school?
Oh, we have ample leave related to COVID for all of our employees, including teachers. And what was the rest of your question?
The union has asked for free testing for teachers and staff and everyone to get a COVID test before they report for duty. You mentioned again that they would be prioritized at testing sites around the district. Do you feel like that meets that demand enough, or is there still some conversations to be had? Because they are also calling for free testing throughout the year.
Well, all of our testing is free in the district, so let me be perfectly clear about that. And I think the regime that we set up in consultation with DC Health and the group that Director Geltard is leading out of our EOC has been exceptional. We report every day on our testing turnaround because testing turnaround is an important aspect of how we contain COVID. So that's also important. Our testing is available for DC residents and workers age 3 and above. So all of the students and teachers and staff are able to get that. We anticipate, as the Chancellor has already mentioned, some on-site testing at schools, especially for anybody who displays symptoms during the day, that there would be rapid testing available to them. Our testing capacity is I'm very confident in our testing capacity. Yes.
Just curious, that the union put out a thing about the Public Employee Relations Board and their apparent decision that questioning whether the DCPS is negotiating in good faith with the union. I know you mentioned it several times today, but things they're concerned about, like school principals telling middle and high school teachers they may be reassigned to elementary grade or cares. What's your reaction to this? So I get the impression that you sort of lost in that hearing with PERG.
Well, may I start, Chancellor? Let me just say, we all have a job to do here, Sam. The Chancellor, me, the Washington Teachers Union, the teachers, the students, we all have a job to do. And I think that we're all focused on the same thing. How do we best serve students? So we can expect a lot of procedural things to happen, including with these boards. And we're going to go and we're going to follow all of them. But at the end of the day, I have to ensure that our children have the best set of learning options before them. And that is what we have spent time talking about today. So I want to be very clear that the Chancellor and all of the educators that work for DCPS have been called on to think about how to best serve children. And that's what we're at the table on discussing with the teachers union, the other unions that are involved at DCPS, and frankly, the non-union people involved at DCPS. Our focus is on how we can best serve kids. Yes.
Well, I wasn't done.
Oh, I'm sorry. Go ahead.
They're saying you're not negotiating in good faith.
We are negotiating good faith.
They complain that, for example, that they find out information when we do. And they said basically if you're negotiating in good faith, they should know about it before the public.
Yes, I'm not sure what they would be referencing there, but we're negotiating good faith. And that's been really clear throughout the process. And I believe even President Davis shared even last night that she's optimistic and hopeful that we'll reach an agreement, as I am. But as it relates, I want to go back to the question about the staff and the secondary staff. And I want to reiterate the point that we are on an urgent mission to ensure that we respond to the needs of our students and staff. And we already know that we have learning gaps. We had known learning gaps prior to COVID-19. And we've created a plan to be responsive to that needs. And there will be consequences. People will have to do work differently. And we will ask for all hands on deck approach. And we've been really clear with our staff that everyone could be detailed to an elementary school. That all of our staff is an option to help us fulfill this mission. But in terms of not bargaining in good faith with the Washington Teachers Union, that's just not true. And we'll be at the table today to discuss what needs to be discussed. And there are management rights that we do have, and we exercise those when we have to.
You noted that, for example, the score, the learning level, I guess, of young people had gone down 9% and 22%. In this, what is that based on? Was there some test taken?
Yeah, so that's based on our early literacy assessments that we administer every year. So that's a year-over-year comparison of where our kindergarten, first, second grade students are this year compared to where they were last year.
These were some sort of tests that were administered?
Yes, these are literacy assessments that assess literacy skills and where students should be at this point in time in the school year as relates to their literacy skills.
And the name of the test?
So there's a assessment called DIBELS and TRC. We use a combination of those for our kindergarten, first, and second grade students.
And if I just might add, Sam, I'm sure I don't have to remind you, and the Chancellor's already said that kids haven't been in their school buildings since March. And everything that we're doing right now is not only going to make us able to serve up to 75% of our elementary school students, but it's going to allow us to move more of our students in February and ensure that kids can be in school this academic year. Absent the steps we're taking right now, we wouldn't be able to guarantee that to DC families, that this school year, I'm not just talking about right now, October, I'm talking about the entire academic year, and all of the steps that we are taking. And they're significant to prepare our buildings, to make sure that we can best consider staff needs and family needs. The steps that we're taking right now are going to prepare us. So not only are the HVAC standards being implemented in our elementary schools, because they're going to be the first to have in-person learning, but the schedule also includes our middle schools and high schools. Yes, Perry.
Just real quick, Chancellor, and then I have two questions. Were these assessments taken virtually at the beginning of the year, or did some kids take them in person?
Virtually.
Okay. And also, do you blame the unions for the situation where we're in right now? I mean, we have kids in care classrooms where they're getting whatever the risks may be from going to school without being taught by teachers. You have middle school and high school staff going into these care classrooms. And at the end of the day, you have 7,000 kids learning from teachers in person. Do you blame unions for the situation that we're in right now? And if not, why are there not more kids going in person for teaching?
Perry, I don't think we have time for finger pointing. So that's not helpful. I think what's most helpful at this point is how do we fulfill our mission? And our mission is to get young people back into our schools who need it and choose to be there. And each day that we go by, we don't have that solution, is a day that I worry about us not delivering on what needs to be done for our students and our families. And we already have data. This is just the start of our data collection process. You know, this alone is very compelling of our youngest learners, and it's something that we've got to focus on and not worry about, you know, who's at blame or who's at fault from my perspective.
And there seems to be broken trust here. When you say buildings are safe, the teachers and parents aren't necessarily believing that they will be safe. Do you think that the city could have done anything different to help when you got to this point to have better trust here?
Let me just say, I don't know any teacher, family, government worker who's experienced a global pandemic. Okay, so let's just start there. We're in unprecedented times. So let's not expect that everybody feels 100% about anything, because we are dealing with a situation that we have never dealt with before. So I feel very confident that we have put a program in place to have our buildings ready, to make sure that conditions in our city support more activity, that we're in, that we can have in-person learning, that we have the PPE and all of the things that the representatives of the teachers have said they needed, that our testing capacity is strong, and that we're building confidence, and that we're going to answer any question that anybody has. And at the end of the day, Perry, parents have a choice. If they think virtual learning works for their family, then they stay in that posture. But for all of the kids that will never catch up from missing 7 months of school, and maybe a whole academic year, if their government doesn't have a plan to get them back in school, this is what we're talking about. Yes?
For a question for Deputy Mayor Kine. We're talking about public DCPS, but about half the students are charters. What's the situation there? How do they compare in terms of what we're discussing here, in-person learning or et cetera?
Thanks, Sam. I think it's very fair to say that we've been extremely pleased with the reaction and innovation we've seen across the charter sector. I think we've shared with you before, my office conducted a number of interviews with charter LEAs. About 30% of charter LEAs are offering some form of in-person touch points with students who they've identified as needing that the most. And we expect that to continue. So clearly, colleagues in the charter sector are looking and assessing what DCPS is doing. They, like DCPS, are looking at all of the successful in-person learning we have currently across the city. We've got more than 280 childcare centers that are open and serving children successfully. We had our DPR in-person summer camps for 3,000 students that worked successfully. We have, as I've said, more than 20 schools that are currently open and serving kids in person successfully. So our colleagues in the charter sector, like DCPS, are looking and learning from all that, and we expect their touch points to continue as well.
Do you think that they may change? I mean, when DCPS moves to this model, that a lot of them will move to a similar model? Is that what you're suggesting?
What I'm suggesting is that each LEA makes what they consider to be the best decision for their school community. They assess what their parents and families want. They talk with their teachers and educators, just as DCPS is doing, and they will make the best determination. What I have observed is that many charter LEAs, like DCPS, feel this extraordinary urgency to meet the needs of students that we've identified as needing more in-person work, and they are following suit.
So right now, it's about 30% that are doing in person.
There, about 30% of charter LEAs are offering some form of in-person work. Sometimes that's tutoring, sometimes it's workshops, sometimes it's full day. So it depends again on the needs that they've identified.
Yes, sir.
Two good questions. Clarification on the negotiations with the union. Did you meet with them today, or you were planning to meet with them later?
We had a meeting scheduled at 11 o'clock, and the WTU asked that we reconvene at 2 o'clock, and we will do so accordingly.
Okay. And then you're talking about, in terms of virtual learning, you were asked a question yesterday, I'm hoping to get some clarification. With the move to in-person, will the class sizes for virtual learners go up?
Yes, there could be classes in a virtual setting that could increase.
Any concerns there with educating those kids who are still staying at the distance learning level?
Yeah, we believe that there's greater capacity for more seats in the virtual posture, just given that, the teaching and learning will take place remotely. However, it's something that we'll continue to monitor, and there may be some schools where we'll have to provide additional resources to support teachers that may have larger classes than others.
Will you have a cap in terms of the most numbers, the highest number of students you can?
Yeah, our current cap is 40 students in a classroom.
Yes, Bill, we'll take a couple more questions.
Yes, for teachers who don't want to teach in person, what happens?
What do you mean, what happened?
If they feel, I understand, you said something about leave applying to teachers who may not feel comfortable teaching in person. Can you just talk about that?
So teachers have access to federal leave and accommodations based on their circumstances, and then also they have received an offer for even local accommodations that go beyond the federal requirements. We're prepared to extend that to our teachers, and it's been something that we've been in discussion with the Washington Teachers Union.
Yes, Perry.
Can you explain how you landed on this testing strategy? I know yesterday you said that, pre-screening testing was not the right, or pre-entry testing was not effective according to CDC guidance. How did you land on this testing as the right way to go, and how much will it cost?
We haven't talked about specific budget numbers for testing for students and teachers beyond the capacity of the city's testing capacity. We do have access to a certain number of the rapid test that we can make available on site. And I don't know if Dr. Nesbitt wants to add. You asked, I don't know what you were asking a chance. I'm sorry, I jumped in.
How you landed on this strategy? I know, for instance, New York is doing random testing. Other school districts are doing stuff to accommodate for asymptomatic people. How did you land on this testing strategy?
Dr. Nesbitt, do you want to join in?
Sure. So I think, Perry, you're referencing some plans that school districts have announced that are in various phases of implementation.
Right.
Yeah, that are in various phases of implementation. Some have not been implemented; they're just plans. The CDC updated their guidance on testing, and what we're doing in addition aligns with the CDC's current recommendation. What we have proposed is that we will be testing students who are asymptomatic, or who are symptomatic, let me clarify, sorry, who are symptomatic on site using a rapid test and confirming If they are symptomatic and negative, they will have to have a confirmatory PCR test, which is more accurate and reliable than the test that will be used, the rapid test, antigen test that will be used on site. We have not developed an initiative that would do the surveillance things that you have seen that are mostly planned. When we communicate with our peers on the public health side in many of those jurisdictions, there is no data yet that speaks to the success of those plans in reducing transmission. And that's what's reflected in the CDC's guidance in terms of whether or not implementing those types of plans is more effective in reducing transmission than the comprehensive mitigation strategies that the DCPS has put in place, including things like implementing the HVAC filters that are gold standard, the other HEPA filters that have been put in place, and all of the other social distancing strategies. So that is why we have landed where we have landed, as you have called it, with our testing approach and strategy.
And what qualifies, do we know what qualifies as a symptom? Obviously, kids have colds all the time, it's flu season.
You got it, which is why we will be recommending a protocol that is very liberal in terms of testing students who present symptomatic with a rapid test, and if it's negative, doing a confirmatory PCR, and the healthcare providers will be given guidance on how to have a child be either quarantined or isolated depending on those results.
Thank you.
Okay, thank you, everybody. So this is just a reminder to parents to expect an email if you have an elementary school student and to respond to that email just as soon as possible. Thank you, everybody.